Now you must understand that glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and scapulothoracic articulation. These forms the shoulder girdle. All movements are interrelated. The humerus has a very minimal osseous support. The shallow glenoid fossa in the shoulder as compared to the deep acetabular socket. So all the dynamic stabilizers, they are of very much importance. They are the muscle, ligament, capsule, and all other soft tissue structures which helps in the shoulder stability as the humerus is hanging from the shoulder joint from the glenoid. The common attitudes are Erb's palsy, the clavicle almost subcutaneous clearly visible from the observation inspection. We can judge dislocation of shoulder, the scapula spangle deformity, which we can see also winging of the scapula can. On the inspection, posterior aspect, lateral curvature of spine, and excessively kyphotic thoracic spine, the Schurman's disease or juvenile kyphosis. From the inspection, you can judge about the sternoclavicular joint, clavicle, grossly about the contour and muscle mass of the shoulder, the axillary fold. In lateral aspect, you can also judge about the acromioclavicular joint, and on the posterior aspect, you can have judgment about the spine, the scapula, the spine of scapula, the counter of the trapezius muscle, the gross muscular variations which are on the posterior aspect. Now the bony palpation, it starts from manubrium sterni, then the sternoclavicular joint, the clavicle, the most curved lateral concave portion of the clavicle, then coracoid process. Again, we can judge about the acromion, the acromioclavicular joint which is lying here. The greater on the anterior aspect, you can have lesser tuberosity, the bicipital groove, the greater tuberosity, the lateral border of the acromion. On the posterior aspect, posterior border of the acromion, the spine of scapula, the flattened triangular area, the from there the superior portion of the scapula, the vertebral border, the lateral border, and the inferior angle of the scapula. These are the structures or the bony palpatory structures. Rapidly see palpation of the acromioclavicular articulation, easier when patient rotates. This is the way you palpate the coracoid process, the way of palpating acromioclavicular articulation. Palpate the anterior aspect of acromion, palpate the bony dorsum of acromion and the lateral aspect. Palpate the greater tuberosity of the humerus, the bicipital groove and the lesser tuberosity by externally rotating the arm. You are always sitting or standing behind. Rotate the shoulder joint with the help of flex elbow and using the arm, and you can palpate the lesser tuberosity, the bicipital groove with biceps tendon and the greater tuberosity. These are the structures which you are palpating on the posterior aspect. Here, it is very simple.